So good evening all. So we are embracing the departments in the hospital day by day and we are getting into new discoveries also. So today we will step out for the ophthalmology department as for diagnosing, treating and getting the clinical settings for a sensory organ eye. So our eyes is a vital organ present in our body and it senses the light energy which gets into our brain and sends out for an image. So as per WHO, the people in the world population, among 200 billion of them are get deficiated with eye diseases and with eye problems. So treat with them and to diagnose with them and to get the clinical setup for them, we are having a department called ophthalmology. It is otherwise called as optometry. So dealing with ophthalmology and optometry, the main function is to treat the eye diseases, treat the eye astigmatism and for treating the refractive errors also. So if our eye is not functioning properly, our vision will be blurred and our sight will be failure due to some of the internal problems like glaucoma, age-related diabetic retinopathy and the diseases with keratitis and keratoconus etc. So the external parts of the eye and the internal parts of the eye combine to give a clear vision with the internal retinal layer also. So the ophthalmologist or optometrist in the ophthalmology department will be able to diagnose the diseases which are present in the patient's eye. Other than that, who does the work of setting an equipment is the one and only biomedical engineers who work with them and who set up the equipment fastly. So for diagnosing the disease, there is a patient and for setting the output. So what are the problems in there? What are the results we are getting from that? It is done by the doctor or clinicians there. So between the doctor and the patient, we are having an interface called as equipment. So it is being calibrated, troubleshooted and found by the biomedical engineer which is used to see the vital signals inside the eye. So commonly ERG and EOG will be presented for detecting the signals present in the eye. So for example, the optic nerve will be helpful to detect the eye signals, to detect the impulses which is got from our external layer of eyes. So if there is any diffraction or if there is any multiple reflections inside the eye, due to that the blurry vision can be occurred. So for that the internal parts can be managed through the EOG or ERG setup in which we will be detecting the retinal signals and ocular signals. So there are some of the imaging techniques and they will be using with the common oscilloscopes to detect in the common output. So the primary objective of the ophthalmology and the equipments present in the ophthalmology department is to detect your common vision problems such as myopia, hypermetropia and presbyopia. So it is commonly called as nearsightedness, farsightedness and the people who are wearing artificial lenses and spectacles can move for their intraocular lens power. So common setup and the common function to detect for a single person who is having the eye problem or eye diseases, they will be having the eye irritation at first. Then they will be having the headaches or it will be accompanied for some of the problems. To detect it and to detect the internal problems, we will be going for a common checkup. So it is done with the imaging techniques with several types also. So firstly, we will be looking for slit lamp, that is otherwise called as biomicroscope. In every clinical practices and in every hospital setups which is containing with the department of optometry, we will be having the vital and essential tool which is called slit lamp. So it is otherwise called as biomicroscope. Why it means a microscope is used to see and examine the internal organisms, internal structures of small microbes which can't be seen through our naked eye. So here the slit lamp will be used to view up to your internal part, up to your retinal part and what are the problems occurring in the eyes also. So common problems will be itchiness or swellingness in your eyes. So it can be detected through the slit lamp by using the ocular lenses and we will be having an illumination system also. So we are talking about the part which is to be sensed inside. Okay, it is not an external part. We are going to sense the activity which is happening inside your eyes so which is one of the sensitive activity also. Okay, so for that we are using some of the illumination system in which the intensity level will be increasing layer by layer and it is passed through the part called slit. Okay, so that slit will be able to make the layers of the iris, cornea, lens, and it can simplify the images also in the proper blood supply and with the proper nerve supply. If the patient is having some of the problem, they will be seated with the slit lamp biomicroscopy, so it will be easy for the consultant also to detect the internal regions. So it has been evolved in 20th century and it is easily admired from all of the persons and it is easily accessible for all of them also. So the light system which are using in ophthalmology department, all kind of imaging techniques, all kind of detecting techniques will be using the common light system with the LED bulb, because some of the people will be having sensitiveness and they will be not ready with dealing with the high amplified electrical signal or high amplified illumination performed today. So the main equipment and the common surgical type like LASIK surgeries or when they are going for cataract surgeries, they look up for the therapeutic one. Okay, they look up for the treatment side equipments in that. At the time also, this slit lamp will be helpful for them to diagnose the internal structures up to the surgery is completed. So we can use different type of systems and different type of filters or colors to detect the internal organs or detect the internal systems which is present. Even though the small cyst or even though the small lightning system or if there is any external pathogen present in the eyelids, it can be also viewed through the common slit lamp. And the common parameters which are going for when a biomedical engineer is going for checking of this equipment or going for any troubleshooting this equipment, the particular department they will be experiencing with more than 2 to 3 years of training for it, because as that's the equipment in cardiology, as that's an equipment in the radiology, it will be specified by the terms of working. But in ophthalmology, the devices are made up with mainly of prisms, contact lenses, and there will be some type of lens, ocular lenses, or there will be a mirror system. So mainly the optical system will be playing a vital role in this department, and even a sensitive small scratches in the mirrors or even a small sensitive issues in the lenses and mirror will affect the output of an image. Okay, so for through the diagnostic examination, the doctor will be conformly checking the calibrating techniques by switching the equipment, by on and turning off with the proper principles also. The main principle here we will be using is the passing of light through the slit. We will be not passing a band of light in a total manner. The finite amount on the single ray of light will be passed in the slit lamp to examine the output structure. So it is a common tool and it has been advanced with the touch modalities also. We are having the advanced slit lamps in the touch modalities in which the person will be having their eyes placed in the screen. So it will detect the electrical signals also. Here we can see only the imaging structure, what are the structures present inside. But in the advanced slit lamps and in advanced devices, we can see the electrical activity according with the movement of iris and the pupil reflection also. The next equipment we are going to say is visual field analyzer. So it's otherwise called as perimetry. Okay, perimetry, because this can used to detect the focal vision. So we have seen the slit lamp. It is used to diagnose the diseases in each and every part, starting from the small cornea up to the retina. But this visual field analyzer is used to determine the focal spot and what is the locus also. The locus is determined as your eye movement, from which point your eye is moving and up to which point it is rotating. We can see the focal vision and the movement of eyeball from one layer to the other layer using the visual field analyzer, and the external parameters such as the longitudinal axis, latitudinal axis, after eyes can also be detected. So mostly anterior segment of the eye and posterior segment of the eye can be detected using the visual field analyzer. And through the focal spot also, through the internal focal spot also, we can see the changes, what is happening inside and what is the main application we are seeing is also can be detected using visual field analyzer. In this also, the illumination system they are using, the common illumination system will be in the normal color formats in white color or yellow color, or it will be in a saffron color, which cannot emit more amount of illumination with the patient. It should not affect the patient's affordability also. For that, they'll be having placed their eyes in the full screen. You have been seeing the screen or display in the outdoor. In that, the eyes will be placed continuously for 10 hours or 15 hours of examination. Within 10 minutes or 20 minutes, they will be taking for live examination how your eyeball is moving. So if you are turning left or if you are turning right, what is the focal spot you are getting? Up to which degree you are going to change your eyes and what is the movement also. It can be all detected using this visual field analyzer. And some of the problems like glaucoma, when is there is any optic nerve damage or when there is any internal diabetic issues. For the diabetic people, they will be having a retinopathy condition in which the retina will be not functioning properly, so it will be not sending the blood vessels properly to your external eye. In that case, your movement of eyeball can also be accessibly changed. Okay, so for the people they're having misplaced eyes, if they're having displaced cornea also, their eye movement will be not proper, they will be not fixed at a single point. So we can detect the degrees of rotation for 360 degrees, 180 degrees and 90 degrees can be accessible using this visual field analyzer. And for some of the people when they are going for therapeutic applications, they are going for cataract surgeries, or for elder people they are going for eye operations. At that time they will be checking using this equipment fundamentally for the movement, because they are going to fix an artificial eye, they are going to fix an bionic eye needs. At that time, the internal placement must be also proper. It should be not detached from the retina, or it should not be detached from the external scleral muscles also. For identifying that, you will be getting the output from this equipment as the signal, and you will be getting the output through in the format of angle also. What is the angle of rotation and how we can detect it. And while calibrating these type of equipments, an engineer must know how to make the sensitiveness more. If the scratches or if the internal illumination system is not proper, the whole setup and the whole output will be affected. So particularly when you are going for an engineer role in optometry department and while going for any calibrating department, it is vital to know about the lenses and prisms and how to calibrate it also. So the third system we are going is for femtosecond laser. This is the equipment which is used in particularly for therapeutic applications. So all we have seen before is for diagnostic applications and to detect it. Here femtosecond laser, it is used to cut the internal parts. It is used to make a cut, or it is used to incise the internal sutures which is present in your retinal blood vessel, or it can be through the nervous structure also. Because this laser equipment will be using the light impulses. It is not using any kind of radiation, that is like X-ray or a gamma radiation. It is a simple format. As we are using illumination system to diagnose, the same illumination light will be used to cut the internal parts also. Once the patient is fixed in a bed and they want to go for a surgery within 2 to 3 hours, they will be not cutting or repairing it with normal knife. It will be not very harmful to the patient and it will be causing more amount of impact also. At that time, this femtosecond laser will be used so that the patient can be fixed at the bed. From the bed, above layer will be fixed with the laser, or it will be using the illumination system. You can see that femtosecond. What does mean by femtosecond means? It is the quarter length of a single second. Within a second, it can send multiple impulses, that is through the light rays, and it can cut the internal parts sharply also. So how can the light detect and how can the light can cut inside internal parts is due to the common illumination system will be having some of the properties with high spark. When the photons is excited more and more, it can make a single tissue into more fragments also. So it is easy to fragment your external cloudiness which is formed in your eyes, or cyst or the heat boils which is present in your eyes can be cut off easily using this laser technique. And when you are going for any keratoplasty, that is the condition in which the ophthalmologist will be using the corneal layer will be misplaced. The corneal layer will be fully taken off from the patient, and they will be fitting the other cornea for the people. At that time also, this laser technique will be used to cut off the cornea which is present between the sclera and the internal parts. So it will be taking very minute second, and time development should be also maintained here. It should be not having more amount of scheduled time to make a single cut. So for that condition only, this equipment will be in the format of CT, or it will be in the format of X-ray. But the principle which is using here is not a kind of radiation. It is only through the light system. The photons will be ejecting out, and it will be striking at a faster manner. For a second, it will be in a millionth or trillionth of a second. From that, we can make a patient lives in more amount of comfortable manner also. It is not getting harmful, and it makes the patient lives more and more comfortable also, and it makes the surgery fast and quick. It doesn't make the surgeon, or it doesn't make the person more panic, so it will be adaptable in the all type of environments. So in plastic surgeries or in keratoplasty, other than that, they will be going for internal implants also when they are fixing any bionic eyes. When you are going for any of the third eyes, or if they are going for any prototype also, they will be removing the total eyes from the part of the body. They will be removing the blood vessels alone. They will be removing some of the nerves alone. At that time, this part of the laser will be helpful, which doesn't emit more amount of light. So the next one is fundoscope. The fundoscope is otherwise called as ophthalmoscope. So most probably the fundus is the area in which your internal part of the eye, it is very deeper manner in which it consists of retina, macula, optic nerve, and the internal part of fovea. These are all comprised with the fundus. So the particular area is responsible for the central vision also. When your light is entering into the eye, the person feels blurriness, or the person can feel blindness, color blindness. So at this time, the fundoscope will be helpful to view the internal part. Okay. So as we see, the slit lamp is used to diagnose the corneal layer, iris layer, which is externally present in the eye. But the fundus is very deeply present inside your eyes. It will be more depth also, like it will be going for centimeter depth. At that time, the normal slit lamp will be not recognizing the particular problems which is present in your external areas. So this fundoscope or the ophthalmoscope will be responsible to view the internal sides around. In this, we can see the blood vessels clearly. If the blood vessels is ruptured, if the blood vessels has no connection between the internal layer and the external choroid layer, we can easily administer this fundoscope using the light system and can see the internal organs clearly. Here also we are using the same light system and the illumination system, and while manufacturing any of the equipment or while making any of the prototype in the ophthalmology department, the kind consideration is for the illumination, because the light system will be getting more and more sensitive for the people. They can be elder people, or they can be an infant also. For them, we can't give the same intensity level as every people are using. Here we'll be using the common light system with a single LED bulb, and it will be having some of the control buttons also, like you can see the internal buttons by viewing. Magnification will be there, and the resolution will be also there. While checking, the magnification will be helped to increase the size of an image. You can see the deeper view, you can see the enlarged view of the image. Resolution is in the sense of the clarity of an image. You can increase the clarity or the pixels rate of the image. If the image is blurred, if the image is not clear, the ophthalmologist will be suddenly telling that the internal part is get failed. But to identify what's the problem between the equipment and what's the problem within the patient, we must know to calibrate it. We must know how to work with it and with the proper experience also. So by using this fundoscope, we can magnify the internal image and we can see the internal parts such as optic nerve, retina, macula and internal blood vessels can be viewed clearly. And the advanced technique of fundoscopy is they will be using single structure. It will be in a thin light structure. In that they will be having an end with a single light source. Without the complication of heavy handling equipment, they will be using a single stick-like structure in which the patient can be examined within a second. So it will be very, very accurate also, and while calibrating with this, they will be going for minute changes in the DC level, because all the type of equipments will be having both AC and DC. And the particular department we are using, it uses compact size devices and it uses the electrical devices also. So based on the requirement and based on the portability, the department's equipment will be varied according to the patient's position also. So the next equipment in the ophthalmology department is OCT, optical coherence tomography. So this is the club of all equipment. So we'll be telling it is a vital or essential tool which will be present in ophthalmology, because the single imaging technique, as we are seeing in fundoscopy, as we are seeing in normal slit lamp, we can see the real live images. We can see the real 2D images, what we are viewing. But what actually this OCT does is, it can give the 3D images and it can give the sections of images of the eye. It can deliberately divide into 250 or 360 sections, and it can give a single layer, and it can detect the tumor integration also. So when you are going for tumor section or when you are going for checking the glaucoma, the doctors will be checking where it has been originated. For checking the origin level and how much it is spreaded, even a small hot boils or even a single repair in your eyes can be checked for its origination and how it has been cured. So for that final treatment while in OTs or while in surgical theatres, or when you are going for a normal diagnosis also, if they are asking the output in the film or they want to get in a proper output in a screen, they will be going for OCT. It can give the 3D images with the scanning technique. As you see, the femtosecond laser doesn't use any of the radiation. This optical coherence tomography, it is a kind of radiology, and it will be not using much amount of radiations also to give the internal sections. Simply it will be passing some of the radiations which is applicable for the patient, and it will be giving the total output. As we are seeing the fundus, as we are seeing the cornea in a separate equipment way, this OCT will be giving the full detailed view of the eye within a single graph or within a single image. In this, the main advantage of using OCT for the doctors is if they want to fit any of the external elements, like they want to repair the optic nerve and they want to make the new optic nerve to be inserted inside, what is the width or what is the depth of penetration also can be checked using the OCT for final treatment. They are going for surgeries also, they will be checking once again before going for a treatment. They will be checking the internal elements of eye and the humor. They will be having vitreous humor and aqueous humor. So it is difficult to detect liquid or semi-solid substances which is present in the eye using the normal slit lamp mechanisms or anything. We can check it, but it is not more and more accurate from there. So for that purposes and all, we will be using this optical coherence tomography to check the internal fluid components, to check the internal electrical impulses and the solid materials present in the eye. So it is more advantageous and it will be present in the imaging technique, particularly for screening or for imaging technique of the eyes, will be using this OCT. So the next is keratometer. As the keratometer is otherwise called as ophthalmometer. As we see long, all the equipments will be used to see the internal organs particularly. This keratometer will be used to check your curvature or check the radius of curvature of your cornea. As a corneal surface, as a corneal spherical surface gives the movement and gives the structure for your eyeball. If the cornea is flatter or if the cornea is getting a steep move, your external parts may get varied. That condition is called as astigmatism. Okay, so the corneal radius will be changed, so that the people will be feeling with some of the blurriness, or the power of the lenses can also be altered when you're having keratitis or the corneal problems. At that time, the keratometer will be used to detect the curvature, anterior curvature of your cornea, and how it is bended, whether it is very spherical or what is the normal curvature also. So the curvature will be like 7.8 millimeter, and they will be detecting using this meter and the unit. What is the curvature and what is the unit deliberated from this is diopters. Most commonly, intraocular power and the internal curvature will be detected using the power called diopters. So they will be telling it in 61 diopters or anything. The doctor or the ophthalmologist will be identifying the curvature range also. So by using this, we can detect only the curvature. We can't check the internal parts. We can't use this equipment to diagnose the internal parts. It is accurately telling the measurement, how the cornea is working and what is the distance also. We can check the common radius from sclera or how it is bended also. We'll be having common mechanical setups in all type of equipment, like we want to change the equipment from one position to the other. We want to adjust the height from one range to the other based on the patient size, and based on the eye size we can adjust all those, and we can change the locking systems also. Once the patient is fixed in an area, he or she can change its position, but the doctor or the clinicians present in the area must have appropriate result in the final imaging result. So for that purpose, we'll be having the locking system in every ophthalmology department equipment. And while you're going for any of the examination and they're going for a final result, they'll be using some of the stains or they'll be using some of the dyes to see the internal clear views. So for that also, we'll be having an advanced feature in the particular department, and at the final stage, the advanced technologies will be related with A-scan. There are more amount of equipment with A-scan, and advanced keratometers will be there, and a single pad slit lamps is there in a patchy way. In a touch manner, we can use to detect the internal parts. So overall, the department relates with the sensory organ, and it relates with the light or illumination system with the optical lens system. It's managed by all of the engineers, particularly they want to know about the internal structure. So the fundamentals of physics, how the lens system is working and how the mirror system, whether it is commonly, will be knowing about the nature of the mirror, like convex or concave. So understanding these principles, the department is very easy, and any of the prototype related with this department can also be managed using the equipment. So while going for diagnosing, imaging and therapeutic, we are having different and several kind of applications using the keratometers, slit lamps and any of the equipment, and they will be going for a testing also. While they are going for testing or calibration, they will be going for final checkup whether the system is working, unless rather than they will be not using for the patient for any of the screening technique or any of the imaging technique. So I hope so all the parameters and all the equipments related with the ophthalmology department is clear. So thank you all, be updated with it.